Musculoskeletal management is when someone starts having an ache, and it's just a first little ache, to help prevent that little ache from turning into an actual true injury.
The ultimate goal was to reduce injuries across the system. So whether it was work-related, it didn't matter if it was nurses, providers, care team members, across the system was to overall reduce the amount of work-related injuries.
Of course, there's always going to be injuries, unfortunately. That's just, when you're doing an active job.
Our business health group has been out in companies doing this for our clients for many years.
Bellin is one of our employer clinics, and the whole idea is we're there to either help prevent injuries or manage injuries.
I think it's very different when physical therapists, occupational therapists, athletic trainers, are treating individuals out in the community that are not healthcare members. I think it's a different way you have to approach if they have the experience in the healthcare setting. They feel like I can just take care of it on my own. So I think sitting down with them and explaining why this is the process and why we go through it first is to make sure, one, you're okay, and then two is to see, is there anything that we could implement or change to hopefully reduce it or prevent it from happening in the future.
So with nursing, we're gonna see a lot of probably low back strains or shoulder strains from having to maneuver patients, even if they think they're gonna feel okay, and they say, oh, I think I'll be okay, but you can visit if you want to. We're like, yes, we're gonna visit in person to make sure, because I don't want you to be tomorrow, this is gonna hurt. So we've really increased that number of touches, which I also think changed the culture.
It's a culture change, a safety culture change for sure, which we're trying to do system-wide, not just in our little world, but hopefully across the whole system, where people will actually see someone doing something unsafe and will be comfortable enough to stop them and say, I don't think that's in their best interest, how about we do it this way?
It's really about building the trust and relationship with the employee from the get-go. And then once you've seen somebody in one department and helped them, this has happened several times since this new team and we've changed, they'll say, so-and-so said they saw you and it really helped, so they recommended I come see you.
Now that the program's gotten going, it's up and running, they're seeing the success already, I think it's just going to further develop because now, as more leaders come on board, they see the benefits, they see the success, it's just going to escalate from there.
The leaders are seeing us coming out and following up with people, more people within the department, and like I said, that word spreads.
Our employees are our greatest resource. This is our business. We are service delivery, without frontline staff providing a service, we have nothing.
That's I guess kind of my passion is you shouldn't have to work in pain. You shouldn't have to. You shouldn't have to live with that pain because if you have kids at home, you want to be able to get on the floor and play with, grandkids you want to pick up.
It's a really personal belief of mine that nobody should get hurt going to work. This is how we make our livings, this is how we define ourselves as people. It's such a huge part of who we are. I really don't want to see anyone get hurt doing that.
I really enjoy helping people, not just to get back to work, but to enjoy their lives outside of work.